Did you know that clinical depression has been shown to have a direct relationship to low testosterone or low T? Older men are at especially high risk for depression. Older men also usually experience a dramatic decline in their testosterone levels. Coincidence? Perhaps, but perhaps not. But it is not only older men who are at risk for depression. Men of all ages who have low T are also more apt to be depressed. The connection between low testosterone and depression is similar to the age-old question of what came first, the chicken or the egg? That is indeed a good question. To apply it to the low T and depression link, consider that testosterone levels begin a steady and inexorable decline in men starting at approximately age 30. By the time men reach their mid-50s, approximately 1/3 of them suffer from low T. Also, men who are overweight, diabetic, or have high blood pressure are far more prone to have unusually anemic testosterone levels. Conversely, men who are battling the conditions mentioned previously also often experience, you guessed it, low T. So, does a lack of testosterone cause these afflictions, or do these conditions cause testosterone to plummet? Tough questions that are challenging to answer conclusively, since many of the symptoms of both conditions are nearly identical. The research into this link has so far been inconclusive. There could be other factors at work that are precursors to these health problems, but currently many signs point to a definitive relationship between low T and adverse health. Depression has raised its ugly head and joined the low T hit parade. Just as men suffering from physical ailments are more likely to be diagnosed with low testosterone, so too are men who have depression more likely to have low T. This link raises a depressing, pun intended, question. Do low T and all of the accompanying adverse health issues, muscle loss, joint aches and pains, fatigue, lethargy, hair loss where it's needed and hair appearance where it's not needed, brain fog, weight gain, fat accumulation, and lack of libido cause depression? Or does the depression that often accompanies aging and low testosterone levels result in a man losing his ability to fight the dreaded health deterioration that comes with aging, or even caring that his body is degenerating? These questions are not easy to correctly and definitively answer. Like the earlier mentioned physical symptoms of aging and depression, the conditions of low T and depression also have symptoms that overlap. Memory problems, brain fog, anxiety, sadness, melancholy, and inappropriate anger. One possibility obtained from a study of mice concluded that testosterone levels might influence serotonin amounts in the brain. Serotonin is a potent hormone that performs many essential functions. One of these functions is to stabilize and boost our moods. As with so many other aspects, aging causes our serotonin levels to nosedive and inhibits older folks from absorbing what little serotonin they manufacture. With these conflicting theories about the connection between low T and depression, it's time to take a look at the research on the topic. A 2004 study aimed to clarify the link between the relationship of low T and depression. Another goal was to give guidance to medical professionals who have noticed the connection but are unsure as to how to proceed with treatment. Dr. Molly Shores led the 4-year study, which consisted of 278 men over age 45. At the study's conclusion, Dr. Shores and her team of researchers concluded that the men with low T were an incredible 4 times as likely to be diagnosed with clinical depression compared to men with standard testosterone ranges. In another study, 200 men who had been referred to an endocrinologist for testosterone deficiency demonstrated symptoms of depression. 56% of the study participants had been diagnosed with depression or were currently taking antidepressants, or showing severe symptoms of depression. The study was led by Dr. Michael Earwig, MD, Associate Professor of Medicine and Director of the Center for Andrology at George Washington University. Washington. Quote, "Over half the men referred for borderline testosterone levels have depression," end quote, Earwig said at the annual meeting of the Endocrine Society. Dr. Earwig also observed that the men were often overweight and were not fans of exercise, to put it mildly. 51% of the participants said that, aside from walking, they were mostly, quote, "couch potatoes," end quote, and performed no other activity. 27% of the men worked out 1 to 3 times a week, and 22% exercised at least 4 times a week. Dr. Earwig stated that 39% of the participants were overweight and another 43% were obese. A mere 16% of the men were of standard weight, and a minuscule 2% were underweight. An astonishing 89% of the study group revealed they had experienced erectile dysfunction, or ED. 69% had diminished libido, 58% had fewer or no morning erections, 52% complained of fatigue, 42% suffered from insomnia, and 27% experienced brain fog and an inability to concentrate. Quote, "A lot of these patients have all these comorbidities and maybe depression or undiagnosed depression," end quote, Earwig said. Quote, "For the patients who had undiagnosed depressive symptoms, I often recommend that they seek a formal evaluation from a mental health professional. For those who have been diagnosed and are overweight or obese, I do encourage weight loss and an exercise program using a pedometer. Loss of weight is associated with the body's ability to produce its own testosterone," end quote. Dr. Cynthia Stoenkel, MD, Clinical Professor of Medicine at the University of California, San Diego, commented that, quote, "When a patient presents with some symptoms and is found to have a low testosterone level, as the Endocrine Society's guidelines recommend, we ask why this is. We know that some very clear endocrine reasons involve the hypothalamus, the pituitary, and the testicles that can be related to diseases that can cause low testosterone," end quote. She continued, quote, "I always feel that the first step in treating these patients is to clarify what the diagnosis is, because we might be able to fix it. We could remedy it. If there is not a clear diagnosis, then the next step we need to do is to repeat that testosterone test, usually several times," end quote. She added that if the cause of low T is still not determined, the next step should be to delve into what is happening in the man's life, his age, and other possible causes of his condition. At that point, she said, "It may be time to consider if, quote, there is a role for a trial of testosterone therapy, again being mindful that there could be placebo effects," end quote. Dr. Stoenkel concluded that the studies into this link are too few to be conclusive and said that, "I think we need more studies to look into this," end quote. In recent years, there has been a surge of double-blind, randomized, placebo-controlled trials on the depression-low testosterone link. The results have been inconclusive. 16 trials that were analyzed concluded that testosterone is a useful treatment for depression in men. The trials looked at several different aspects to home in on regarding testosterone's effectiveness. Testosterone was a more efficient mood booster in men under age 60. In older men, testosterone was not as effective. Testosterone was most useful in men with either minor depression or dysthymia, a type of depression that has less intense symptoms but lasts longer. With severely depressed men, testosterone helped, but not as much as with men with less severe depression. Unsurprisingly, TRT was a mood elevator in men with low T, but men with normal testosterone levels were not significantly helped. A Japanese study observed 50 men with an average age of 57 who had low T and were treated by urologists at the Kobe University Graduate School of Medicine in Japan. At the start of the study, 30 of the participants were diagnosed with depression. For this group, depression dropped after 6 months, And by the end of the survey, only 11 of the 30 were still afflicted with depression. A significant drop.